time-lapse technology. So historically, what happened was you would have your egg collection, they would go into an incubator, we'd take them out of the incubator, mix the sperm, we'd check them the next morning, they'd go back in the incubator, you might check them on day 2, you might check them on day 3, you might check them on day 5, and again on day 6. So all you get is little snapshots, and you're having to remove them from their environment to check them. Bearing in mind, embryos have to be cultured in high CO2 environments, not 20% oxygen, which is what the normal atmospheric conditions are. So you're disrupting their environment by doing that. With time-lapse, what it allowed to do was to basically put a camera into the incubator, and you can monitor all of those embryos every 10 minutes without disturbing that environment. And what that allowed us also to do is see the whole development throughout their entire process. And that allowed us to deselect embryos. So, for an example, on the old system, if you checked an embryo and it was fertilized, and then a 2-cell, and then an 8-cell, and then a blastocyst that you'd think it was good. With the time-lapse, you might see the fertilization, then that divide straight into 3 cells, and then, which is not a good development point. You might see it not be as good on day 3, but it still makes a good quality blastocyst. And it's allowing you to deselect those embryos and look at what's called morphokinetics to help us select the best embryos for patients and give them the highest chance of pregnancy. Now, when you compare the outcomes, so if you look at clinical pregnancy rate per transfer, whether it's a time-lapse embryo or a conventional incubator embryo, the pregnancy rates are identical. But what the laboratory key performance indicators have shown, actually in the time-lapse incubator, you get a lot more blastocysts formed, significantly improved blastocyst formation rate. And what that does is allows us to freeze more blastocysts. So say you get 4 blastocysts frozen in a time-lapse and 3 in a conventional incubator, you've then got up to 4 attempts of frozen embryo transfers of getting pregnant versus 3 with a conventional. So you have a higher cumulative live birth rate using time-lapse technology.